Hello everyone, welcome back to the channel. I am Dr. Aayushi Choudhari and today we are going to study DNHE 2 Public Health and Hygiene, Unit 1 Population Dynamics and Epidemiology. This lecture will help us understand how births, death, diseases and other vital events shape the health of communities. By the end, you will see how these numbers are not just statistics but stories of human health and progress. In this lecture, we will study Introduction, Role of Vital Statistics in Public Health, Vital Statistics in Asian countries, Sources of data on vital statistics, fertility measures and determinants, epidemiological methods, morbidity, mortality and their determinants, and other population parameters. So let's start with the introduction. Population parameters such as birth weight, life expectancy, and infant mortality are more than figures on paper. They directly influence nutritional status and overall well-being. For example, lower birth weight is linked to higher infant mortality and poor health outcomes, while life expectancy reflects the quality of healthcare and living conditions. In this unit, we will focus on vital events like birth, marriages, diseases, and deaths, and study their levels, trends, and determinants. Next is objectives. Our objectives are clear. First, we will describe the levels and trends of population parameters in India and other Asian countries. Second, we will compute major rates and ratios related to marriages, birth, deaths, and growth. Third, we will identify the major determinants and patterns of vital events. And finally, we will explain the prevalence and control of major diseases. Next is role of vital statistics in public health. Vital statistics are the backbone of public health. Fertility and mortality rates reflect the overall quality of life in a community, making them indicators of socio-economic development. They also help in planning health services, guiding policymakers to set objectives such as reducing child mortality. Moreover, they allow comparative analysis between countries and communities, helping us measure the impact of public health programs. For instance, if infant mortality drops after a vaccination campaign, this is clear evidence of success. Vital statistics in Asian countries. When we look at Asian countries, we see different priorities shaping outcomes. Nations like China, Thailand, Malaysia, and Sri Lanka invested heavily in health, education, and infrastructure, which led to better mortality and morbidity rates. In India, however, emphasized industrial and agricultural development over social development, and as a result, it lags behind in some health indicators. This contrast shows how development priorities directly influence population health. Next is sources of data on vital statistics. The main sources of data on vital statistics are census, population registers, sample registration scheme, national sample surveys, health services records, special surveys, disease registers. First is census, which is conducted every 10 years and provides demographic details. Population registers maintained continuously in countries like Sweden and Korea record demographic and migration data. India uses the sample registration scheme to collect data on births and deaths through records are often incomplete. National sample surveys conducted since 1950 provide socio-economic and demographic data. Health service records give hospital-based indicators such as maternal mortality and immunization coverage. Special household surveys provide age and disease-specific mortality data, while disease registers maintained by hospitals track morbidity and mortality trends. Together, these sources give us a comprehensive picture. Next is fertility measures. Let us now discuss fertility measures. The crude birth rate or CBR is the number of live births per 1000 population. In India, the CBR in 2018 was 20 compared to 12 in Sweden and 11 in the USA. The journal fertility rate or GFR measures births per 1000 women aged 15 to 49. India's GFR was 70.4, higher in rural areas than urban. The total fertility rate or TFR is the average number of children a woman would have in her lifetime. India's TFR declined from 3.2 in 2000 to 2.2 in 2018, showing progress towards stabilization. The net reproduction rate or NNR measures the average number of daughters replacing their mothers. India's NNR is below 1, indicating population stabilization. Next are mortality indicators. Mortality indicators are equally important. The crude death rate is number of deaths per 1000 mid-year population in a year. In India, it was 6.2 in 2018, lower than Sweden and the USA. Next is infant mortality rate or IMR. It is deaths of infants under 1 year per 1000 live births. In India, it was 32 per 1000 live births, higher in rural areas than urban. Next is neonatal mortality rate, which measures death under 28 days, which was 23 in India compared to just 2.8 in the UK. Perinatal mortality includes stillbirths and deaths within 1 week of birth, often due to complications during delivery or congenital disorders. Post-neonatal mortality. It is deaths between 28 days and 1 year, which was 9 in India. Toddler mortality rate. Deaths of children aged 1 to 4 years was 5.78, highlighting issues like malnutrition and infection. Another very important statistical data is maternal mortality rate, which is deaths during pregnancy or within 42 days of delivery. It was 113 in India compared to only 4 in Sweden. Next are additional population indicators. Other population indicators also tell us important stories. In India, sex ratio in 2018 was 899 females per 1000 males, and Kerala having the highest ratio and Haryana the lowest. Life expectancy in India was 69.66 years in 2019, slightly higher for females than males. Low birth weight. It is defined as newborns weighing less than 2500 grams, which affects 25 to 30% of births in India, placing infants at higher risk of mortality and infections. Next is Millennium Development Goals. Finally, let us look at the Millennium Development Goals. In September 2000, 189 nations agreed on vision for the future, a world with less poverty, hunger, and disease, great survival prospectus for their mothers and their infants, for better educated children and equal opportunities for women and a healthier environment. A world in which developed and developing countries worked in partnership for betterment of all. This vision took the shape of 8 Millennium Development Goals. All UN members states, including India, agreed to try to achieve these goals by the year 2015. These 8 Millennium Development Goals are as follows: to eradicate extreme poverty and hunger, to achieve universal primary education, to promote gender equality and empower women, to reduce child mortality, to improve maternal health, to combat HIV, AIDS, malaria, and other diseases, to ensure environmental stability, to develop a global partnership for development. To conclude, population dynamics and epidemiology are not just our numbers. They represent lives, communities, and the future of public health. Here are some questions from this unit which are important from exam point of view. Additionally, you can go through the questions given in exercises in the study material.